गोंयांत वर्ल्ड एड्स डे मनयलो. गोवा स्टेट एड्स कंट्रोल बोर्डान हाचें आयोजन केल्लें. ही कार्यावळ पणजेंत जाली. पळोवयात.
World AIDS Day is celebrated to commemorate those who are infected with HIV and also to remember those whom we have lost to AIDS related health issues or diseases. This year the theme is Take the Rights Path. Human rights, as we know, is very, very important for each and every one of us, and more so for those who are vulnerable and marginalized. Those with HIV AIDS face a lot of stigma and discrimination, due to which many of their rights are compromised. Their right to health, their right to work. So in this regard, this year's theme is very, very valid to see that all their rights are protected. We all need to work and strive towards achieving this goal this year. In addition, because this will help us to achieve our goal of zero new infections, zero deaths due to HIV AIDS, and death and zero stigma discrimination. All this is interrelated. How come? Because if there is no stigma discrimination, people will come out more with their status. They will they're willing to get themselves tested, so their treatment starts early. So we are able to detect the new infections much earlier. Also, this will prevent them from transmitting the infection unknowingly to their loved ones. Once there is no stigma discrimination, people are also willing to come out and take their treatment regularly, avail all the facilities which are available. So let us all renew our commitment to serve the cause of HIV AIDS and see that we have zero new infections, zero deaths due to HIV AIDS, and zero stigma and discrimination.
So how Goa stands in AIDS control?
Actually, currently we are doing quite well. We have increased our testings much beyond what is our targeted. And but however, the number of infections which we discover every year, new infections, are almost the same. We have static around 240-250 cases which we detect every year, new infections. So although the testings have increased, the number of infections have not increased proportionately. So we can say that the prevalence is more or less static. But we are aiming that we should not have any infection. Nobody should get infected. So that is our goal basically.
The basic areas which can be identified.
So we have found, as per our statistics, that Bardez, Mormugoa, Salsett and Tiswadi, these are the talukas which are having higher number of cases. So and sexual route is the most predominant route of transmission of infection, and little bit from mother to from parent to child, which is again through sexual route, means the parents have acquired through sexual route, and then from one of them it goes on to the child. So we would say, I think the sexual route is the most predominant route, and if we work, and that is totally preventable. So if we can do that, I think we would have been doing a great work in cutting the transmission of infection.
Any deaths have occurred?
Yes, very few. So that is why we say, if there is no stigma and discrimination, people will come more for testing. They'll not be detected in the late stage. They'll come earlier stage, so they'll be started on treatment early. Number of deaths also will reduce. Over a period, we have naturally, we have reduced the deaths by 93%. But we hope that the few people also, like say 20-30 who die every year, that we are able to give them treatment much earlier, and we are able to prolong their life better.
Today we are gathered here on the World AIDS Day 2024, a day dedicated to raising awareness about HIV AIDS, supporting those living with the virus and honoring the memory of those we have lost. It is both an honor and a privilege to stand before you as we unite in our commitment to combat this global health issue. Firstly, I would like to acknowledge the tireless efforts of healthcare professionals, activists, and the organizations working day in and day out to make this difference in the lives of those affected by HIV/AIDS. Your dedication is a beacon of hope for countless individuals and families. This year's theme, Take the Rights Path, reminds us that our collective action in protecting the right. If we do take a collective view, focused direction and dedication, we can end AIDS as a public health threat by 2030. We must stand together across communities, nations, and continence to ensure that everyone has access to prevention, treatment, and care. Education is our strongest weapon against HIV/AIDS. By raising awareness and understanding, we can dismantle the stigma that still surrounds this virus. Stigma and discrimination prevent individuals from seeking testing and treatment, which is why we must advocate for open conversations and inclusive policies. Our brotherhood and solidarity are at the heart of our movement. It is our responsibility to support one another, to listen to the voices of those affected, and to ensure that no one is left behind. We must empower these individuals to take charge of their health and well-being and foster environments where they feel safe and respected. As we reflect on our progress, let us also recognize the work that lies ahead. Let us commit to increasing access to education about HIV prevention and treatment, supporting initiatives that provide free testing and healthcare services, advocating for policies that protect the rights of those living with HIV/AIDS. Together we can create a world where stigma is eradicated, where everyone has the chance to live healthy and fulfilling lives, free from the fear of discrimination. In closing, let us remember that each of us has a role to play in this fight. Together we can build a future without HIV, a future where compassion and understanding triumph over fear and ignorance. Thank you for your commitment, your courage, and your compassion. Let us continue to work hand in hand towards a brighter, healthier tomorrow. Thank you.
गोवा 365 खातीर विलियम रॉड्रिगीस, गौतमी गांवकार आणि वैष्णवी साळगांवकार.